I was out by our swimming pool and she was running and she ran right into the swimming pool.
By the time she turned 8, she had developed full-blown cataracts.
About a month ago, we noticed that she had one eye clouded over and she kept bumping into things.
Your dog can't see because he's got cataracts. And cataracts are opacity of the lens. They are not painful, they don't hurt your dog in any way, but it's a slow diminution of light in his eye. So slowly the days have gotten darker for him and he has no visual acuity, and he's just wondering where everybody's gone. What we can do are some tests to see if your dog is a candidate for cataract surgery. So an eye exam starts with assessing vision, and that's easily done just by doing a menace test, which is a crude measure. Hey Kai, can you open your eyes? Kai, good boy. Good boy, Kai. So with this handheld microscope, I can assess the cornea and the iris and the lens and see what state the cataract is in, whether it's immature or mature or hypermature. One of the other things that we'll measure is their intraocular pressure, and we'll look at see if they have any signs of glaucoma prior to surgery, because that's one of the complications after surgery. And to do that, I would put a drop of anesthetic on his eye. You can't eat that. I'll just gently touch this. What we can do is we can surgically remove the lens and the white material that you see so that light can go back in through his eye and he has vision again.
There isn't any reliable medical treatment for cataracts that will reestablish a clear lens. No eye drops and no oral medications will do that. But thankfully, cataract surgery can be performed in dogs just as it is in people routinely. And the surgery can be performed exactly the same way to remove that cloudy lens, replace it with an artificial lens, and reestablish a visual eye. And 90% of dogs have good to excellent vision after cataract surgery. We use the same equipment and techniques that are done in people with a state-of-the-art phacoemulsifier to break up the lens and remove it through a small 3mm incision, and then replace that lens with the artificial lens, closing that incision with just 1 or 2 stitches. Most dogs can see when they wake up from anesthesia, and certainly by the next day after surgery. Most cataract surgeries are performed in the morning, and patients go home that afternoon. We request a reevaluation the following day, and then a week later, and 2 weeks after surgery, but the time in the hospital is minimized, and rarely do we keep patients overnight after surgery. The most rewarding part about doing cataract surgery in dogs is seeing that family as they see their dog who sees them for the first time in a long time.
You're a good girl.
I think the surgeons and the techs are just wonderful. They're very caring and very concerned, and they're good. The results are just remarkable.
They did a tremendous job here. This hospital is probably better than most human hospitals.
She is just absolutely perfect. And if I had to do it again for her, I'd do it in a heartbeat. She is just such a great, great dog and a great patient. And the doctors down here have been fantastic.